Welcome to the Med Spa Method. My name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist and the owner of Real Aesthetics and Wellness. This show is your guide to navigating the med spa world with confidence. I'm going to talk about the treatments, the trends, and how to find a provider that you can trust. Because when it comes to your health, your face, and your results, there is a right way to do it. Hey everybody, my name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist. I spend most of my days doing anesthesia, but I did start a medical spa, and I have a real passion for medical aesthetics. So I've started this podcast to talk about all things medical aesthetics. I want to talk about the treatments that are trendy. I want to talk about the treatments that are ones to stand by, that are like the gold standard aesthetics treatments. I want to talk about safety. I want to talk about finding the best provider and how you know that the provider is best for you. I want to talk through asking the right questions and getting the right answers, because your face, your health, your results, those things are really important. And doing it all right, there is a way to do it all right, is what I'm saying. So in today's episode, I want to first talk about TikTok trends and the things that we're seeing on TikTok, why they're trendy, and kind of what my take is on it. So without further ado, I will jump into DIY Botox. I think that this is the thing that I've seen the most of, and perhaps because I've watched some of the TikToks on it, like now it's in my algorithm, so I see it a little bit more, but I've been absolutely horrified by it. Not only because I've seen the TikToks, but I've also seen the news reports of people getting harmed from using the bad product that they've gotten from somewhere online that was not reputable. It wasn't real Botox, and I've seen reports of people using this faux Botox, both as a patient and just doing it at home. And I've also seen reports of providers buying this faux Botox and then injecting it into their clients and seeing some, bad results or getting caught using this faux Botox. So one thing that I will say that I think is a positive about some of these DIY Botox videos is that I've had clients come to me and say, well, what do you think about this? And show it to me. And what they're showing me is something like a Nefertiti neck lift, which I otherwise hadn't discussed with them quite yet. And it kind of opens the door for me to discuss those things with them, or using a Botox for a little nose lift, or addressing a, crow's feet a little bit differently or something. And I like that my clients feel that they can come to me and say, what do you think about this TikTok idea that I saw? Or, it's not always Botox. Sometimes it's a treatment. Do you have a treatment like this? This is what I would like to get. So for that reason, I'm really thankful for TikTok and for social media and for people getting out there and saying, these are the treatments that I've had done or that I'm going to have done, or these are the treatments that we're doing in our medical spa. I think all of that is wonderful. It's really opening the door for discussion. I just get a little bit nervous with the at-home treatments, and you'll kind of hear that theme throughout as I go through the other things that I've seen as real trendy on TikTok. So aside from DIY Botox, the other thing that I've seen is DIY dermal filler, which actually scares me even more than Botox, because with dermal filler, the biggest, scariest complication that we often talk about is something called a vascular occlusion. A vascular occlusion means that, there's all this blood flow in our face, very important blood flow. And if you accidentally inject dermal filler into a blood vessel, it will clog it like a clot. And we're very familiar, I feel like, as a society to understand that a heart attack is a blood clot in the heart that stops the blood flow to the heart muscle itself, and then the heart muscle dies, and then the person dies. Well, the same thing happens in the face. If you take away the blood supply because you've made a blood clot or a dermal filler, blockage in a vessel in the face, you can stop blood flow to that area. So if we're talking about the lips, then sometimes we're talking about losing a lip, or even it could track up. You could lose a chunk of your nose, you could lose a chunk of your face here. All of these blood vessels, they're very important. So it's scary that people are buying product and injecting it, not knowing how to inject it or not knowing where the blood vessel supply is. That part's really scary to me. It's also scary from a sterility standpoint. Are these products actually sterile? If they're not sterile, then they could be causing an infection. And dermal fillers are technically an implantable product, meaning that they're meant to go there and stay there. So if they're dirty and they're meant to go there and stay there, then they could cause a big infection in whatever area they are. And even if they are sterile, at home, you don't necessarily know the proper technique to inject them cleanly and safely. So just a huge risk, I think, of injecting product to yourself at home from, a vascular occlusion standpoint, also an infection standpoint. It's very scary. And then product selection at home is also very scary because there are different types of products that we use for different reasons in different areas of the face. For example, we want a nice firm product in the cheek for structure, and under the eye, we want something very soft and very delicate because it's a very soft and delicate area. So for those reasons as well, I find at-home injections of dermal filler to be very scary. I heard of something called like a hyaluron pen. I don't know if I'm even saying that right, but it's some sort of pen that helps you inject lip filler properly. And I've heard nothing but trash about it. I've heard that it's causing just a multitude of problems. So I would absolutely caution someone away from ever using a hyaluron pen at home, which is some sort of injectable device to help you inject your own dermal filler into your lips. So I know that it costs way more money to go to an injector and have the product injected in a medical spa than to order it from Alibaba and do it yourself at home. The difference is you're paying for a quality product and you're paying for a quality injector. And I just don't think that that can be ever dismissed. You're paying for the expertise of somebody to inject that product properly so that you get a good outcome and so that you have way less likelihood of experiencing any of those types of issues such as vascular occlusion, lumpy filler, infection. And should you experience any of those things, you have a person that can help you manage them versus at home where you're just by yourself and your only resource is the emergency room. Something that's also not talked about often is I was an emergency room nurse, so I feel like I can say this. The emergency room is not used to dealing with aesthetic emergencies. So should you present to the emergency room with a vascular occlusion in your face, they're not going to know immediately what to do about it. It's going to take a little bit of digging, and I don't think that you'll get the absolute proper care that you would get if you first went through a qualified injector, had that product injected. If you experienced a problem, that injector would be able to guide you and help you get the appropriate care that you need. Sorry, little sidebar there. The next thing that I see often on TikTok is not necessarily bad either. It's called slugging, and it's when people put a whole bunch of products on their face and then they hold it in with something occlusive. So when I say occlusive, I mean something like Vaseline or Aquaphor, and those products are meant to keep anything from coming back out. So the idea of doing a slugging technique is to put these products on your face that have quality active ingredients like retinol, vitamin C, a whole bunch of moisturizers, hyaluronic acid, and then holding it into your skin with this occlusive product so that you can't waste it or so that you get a maximum benefit out of it. So for some people, this might be a nice technique. Let's just say, I could see this to be very applicable in somebody who has very dry, thirsty under eyes. I would suggest you would put on your under eye product, let that soak in, and then a thin layer of Vaseline. That might be nice as your bedtime routine to hold in maximum moisture to your under eye. However, I see this to be a little bit of a problem when done improperly. Let's just say you struggle from acne and you're putting on a retinol, niacinamide, maybe some vitamin C, and something with an acid in it, like salicylic acid. And then on top of that, you're holding all of that in with something occlusive. Now you're holding these very strong products up against your skin, and you're not letting your skin breathe. So what could happen is you could burn your skin, or your skin could get way worse. You could experience much worse acne, because you're holding in all of your skin's moisture and bacteria as well. Acne is a lot of bacteria and active acne. So holding all of that in, I could see being a big problem for someone who struggles with acne. I could also see it as a problem for somebody with really sensitive skin, or when you're stacking a lot of products and then putting the Vaseline on top. So if you jump back 10 seconds to my example of when it could be helpful, it was one product and then the Vaseline. I personally do not like Aquaphor. I find it irritates a lot of people's skin, so I would steer away from Aquaphor. And if you must use an occlusive at home, plain old Vaseline is going to be your girl. Plain old Vaseline doesn't have additives in it or scents or anything extra that's going to irritate your skin. So that would be my go-to if I needed to have an at-home occlusive ointment for some reason. Similar to that technique of slugging, there's something called skin flooding, in which you use like 7, 8 products, maybe more, all at one time. And you'll see these influencers just spritzing their face, just tons of products, just layering it on and then spritzing, and just putting so much on their face at a time. And the idea is that you're going to just overload your skin and make your skin soak it all up. And I'm here to tell you, your skin can soak up only so much. You can't put into your skin 7 layers and expect your body to get all of it. And you also can't expect all 7 of those layers to behave well together. Now, certain brands do study their products together, like we carry Revision Skincare, and they study all of their products together, meaning that you could cocktail them all together in your hand and put them on your face together. But plenty of other products specifically say, let this soak in before you put something else on. And that's because it could be easily neutralized, or it could be made more acidic by the addition of other products. So by throwing on 7, 8 products at a time, then you could be either neutralizing or overactivating an ingredient in one of those products, and you're also just not going to soak all of that in. So my suggestion instead would be one that's a little bit more cost effective. Wash your face or get out of the shower. While your face is still damp, I want you to put on a little bit of hyaluronic acid. My favorites are our raw hyaluronic acid. Raw is a brand that we developed at Real Aesthetics and Wellness, and our hyaluronic acid product has some firming peptides in it as well, or the hydrating serum from Skin Medica. So what we're going to do, I'm sorry, totally misspoke. It's called Hydrating Serum from Revision Skincare. Skin Medica does make one. It's called HA5 or HA5 Plus Collagen. Those are very silky products. I just don't find that they behave quite as well with the addition of water personally. But we're going to have a little bit of a damp skin, and we're going to put on that Revision product or that raw product right on top of your already damp skin. Hyaluronic acid itself pulls water. So if you have a little bit of water on your skin in the first place and you apply your hyaluronic acid product, you're going to get more bang for your buck. The product's going to go a little bit further. One pump will cover your entire face and neck. Versus if you're doing this skin flooding technique, you're going to take these expensive products and you're going to load them up, 7, 8 pumps on your hand, and flap it on there without the addition of water. And you just used 7 or 8 times the amount of product that you need to use. After your hyaluronic acid based product that's really going to give your skin all of that moisture, then I would suggest going in with your most powerful super serum that's in your regime. So that's going to be something like TNS by Skin Medica, a growth factor serum, DEJ boosting serum by Revision, one of those products that is going to have growth factors to stimulate your collagen production and to brighten your skin and reduce your wrinkles. One of those super serum products is going to go on next. Let that soak in. And then if it's daytime, I would go in with my vitamin C at that point. Or if it's the evening, then I go in with a retinol at that point. And then after that, I would hold that all in with my moisturizer. So it's really just a 3-step routine. Morning and night differs a little bit in the sense that we're using vitamin C and SPF in the morning, and we're using retinol and a heavy moisturizer at nighttime. I personally don't see the need to flood your skin with way too much product. In my opinion, we're not absorbing all of that. We're just wasting money, and I don't think it's right to encourage people to waste their money. So I believe in the integrity of saying, hey, this one pump should do the trick and not 7 or 8, because then you buy the bottle 7 or 8 times sooner than you would if you just use the appropriate amount, which most of the time is going to be 1 pump of the product. So I'm not personally a fan of skin flooding. And now that you've sat through my rant on that, I'll move on to my next home treatment, which is IPL treatments at home. I've seen a few home IPL treatment ideas. One of them, most of them are made for hair removal. And I personally feel that that is a little bit dishonest, because the technology behind IPL is truly not hair removal. It's not permanent. It's hair reduction. You do the treatments to slow down the hair growth, but it's never permanently killing the follicles. So by selling you this idea that you'll buy this device for $200 or $300 and you can become hair-free throughout your full body is a lie. And again, I don't feel it's right to be dishonest to people. So an IPL treatment for home is going to be the best for slowing hair growth. It is a little bit uncomfortable, and there are some layers of it that can be unsafe. And so for that purpose, I don't love home IPL treatments. I'd rather that you spend your money going and getting actual permanent laser hair removal. So for us, we offer at Real Aesthetics and Wellness, we offer a diode laser hair removal, which is permanently killing those hair follicles. We do offer IPL, but we don't use it for hair removal because, like I said, an IPL is truly hair reduction. We use an IPL for skin problems such as redness, targeting redness like rosacea, or targeting overpigmentation in the skin like sunspots. We're not using IPL for hair removal. We don't even say hair reduction with IPL because it's pretty uncomfortable and then it's not permanent. So when clients ask us about it, that's simply what we say. We do have an IPL. We like to use it for redness reduction and for pigment concerns, but we don't love to use it for unwanted hair because it's just reducing the hair temporarily. It's going to take you the same amount of time and the same amount of discomfort, which is not that much, but same amount of time and discomfort to just get permanent hair removal with a diode laser. There are plenty of other lasers that will remove your hair permanently. And if that's something that you're looking at, I ask you or advise you to ask whoever you're seeing, is this permanent or is this just hair reduction? Because that's an important disclaimer that should be made when you're going in for those treatments. Next is going to be red light therapy. There's a couple of red light therapy devices out there in spa, and then there's separate ones that are a little bit gentler that you could use at home, like the Omnilux mask. And those are great treatments on the right candidate. Some of them have red light and infrared. Some of them have some blue light built in. And depending on your skin concern, those can be a great device for you. The at-home ones, if they have a blue light in them, that's something that you could use every night or maybe 3-4 times a week for acne, but it's not going to be your go-to for like big, massive results. Those big, massive results are going to come from something massive, like a big laser treatment or something in spa. These masks should be targeted towards maintenance, in my opinion. I feel it's a little bit dishonest to tell people they're going to get these huge results with the mask and using it, every night or 5 nights a week or something, when really these masks should be targeted towards maintenance. If you get a big treatment and you see massive change, you can keep up with that change with an at-home mask, but I've personally not seen anyone have massive change from just using a red light at home. And it's also not been, in my opinion, clear to the public the people who should not use one of these masks at home. So if you have rosacea or melasma, a straight red light mask might make your rosacea or your melasma worse, and nobody wants to hear that. So if you have one of those skin concerns, please talk with somebody before you start using one of those masks at home, because it could definitely worsen those problems for you. And melasma is very hard to treat. Rosacea is very hard to treat. You certainly don't want to be making those things worse. So you need the right mask with the right wavelength for you and your skin concerns. Next on my list is microneedling. I've seen a lot of different types of microneedling that is done either at home or in the spa. In the spa, I absolutely love the Skin Pen microneedling system. There's a reason that name is so well known. It's because they do a wonderful job. Their device is very controlled. The needles are pushed and pulled. They're not spring-loaded. So the needles are very controlled. That's why they call it precision. And the device itself is like completely closed off. So there's no chance that someone else's blood is on the pen and can get into your face, which is important. Cross-contamination is important, that the device that you're being treated with is not cross-contaminating in any way. There are some cheaper devices out there that are marketed towards home use, like the Dr. Pen, and then clinics who don't want to spend the money on a professional device end up using that Dr. Pen for client treatments. And since there's a risk of cross-contamination, you're now at a risk. If you get that treatment with that device, then you're at that risk of getting someone else's blood, which could be bloodborne pathogen ridden, all over your face. So I definitely recommend a quality device when you're going in to have these treatments done in the spa. And when you're thinking about doing them at home, my recommendation is no. You should not be doing these treatments at home. And the reason you should not be doing them at home is because most of the devices out there are not regulated, which means that the needles could be rusty, they could be dirty, they could be not sterile, they could be not sharp. They're often spring-loaded because that's cheaper. And so the amount of pressure that's on your face with the pen itself really matters. You could be getting a very uneven treatment. You can very much scar your face. You could get an infection, or you could destroy the collagen in your face and get terrible results. That, along with, you can't get quality numbing medicine without a prescription for it, so it will not be comfortable. And on top of all of that, you will not be getting the results that you're looking for. So I don't love at-home microneedling. The other way that I've seen people do microneedling is with a roller. So the roller is set at a certain length of needle. It's got a whole bunch of needles on it, and you roll your face with it. So with that, my concern is the needles, when they go into the skin, enter at one trajectory and then exit at another. And what's scary about that is it's making this awful shaped wound in your skin. Microneedling should be done in a sense that the needles go straight up and down. The needles should be clean. Your face should be clean, and the proper product should be applied afterwards. With those microneedling rollers, the roller is, maybe it's clean, but it's entering and exiting at these various trajectories. And I can't get behind that. That's going to cause little tears in your skin. That's not the goal here. The last thing I'll say about home microneedling is the products that are used to clean your face beforehand and the products that are put on after your face is microneedled really, really matter. Everything should be post-procedure safe and should be stimulating further collagen production and further healing. And if you're doing this treatment to yourself at home. We can't guarantee that you're using the right things. And oftentimes, what's available over the counter is not post-procedure tested or post-procedure safe. So I do not recommend home microneedling to anybody. Similar to that is home chemical peels, or something that on TikTok they're calling acid stacking, which is where you put a whole bunch of actives on your face at the same time of different acidities to stimulate a result similar to a chemical peel. And I'm again going to advise you not to do that. The reason is because, again, it's not a controlled environment. You're not trained to do so. So you could put on too many layers of a chemical peel. You could put on the wrong type of chemical peel for your face, and you could put on the wrong products afterwards. All of these things could result in a chemical burn. It could result in scarring, lots of discomfort, and just not the results that you want. Without getting these chemical peels from a reputable source, you don't know what's actually in them, so you don't know if you're actually going to get a good result. There are some at-home chemical peels that I would get behind, and the one that's off the top of my head is the Obagi Blue Peel, which is like an at-home Jessner's peel. That one Obagi is a brand you can trust, and you can get this peel at home. They'll teach you how to do it in the box, and it's excellent for acne treatments. So if you absolutely must do an at-home chemical peel, do it from a brand like Obagi, someone that you can trust. I'm not paid by Obagi. I don't even carry them in my spa. I just know that they offer this treatment. And I've looked at it, and my thought was, if I was going to do an at-home chemical peel, it would be an Obagi peel. So you could do the blue peel from Obagi if you absolutely must. Otherwise, go ahead, go into a medical spa and treat yourself. Get a real chemical peel with a real professional and get real results that someone else will guide you through and get you the right post-care treatments with it, along with it. And the very last thing on my list is going to probably take me the longest, and that is peptides at home. The peptide world has exploded. There are places all over the internet where you can get peptides either with or without medical guidance. And what's just absolutely freaked me out about that is the without medical guidance. There are places that you can buy research grade peptides. Those are not only not tested for purity, they're not tested for sterility, they're not tested for safety, they're not tested for additives that could be harmful in them. And yeah, they're incredibly cheap. That's because nobody's testing them and nobody has to be held accountable for what happens with them. I've seen multiple stories of people who have injected those peptides and have ended up in the hospital with rip-roaring infections in the intensive care unit. I even know of a nurse anesthetist like myself, a highly educated person that was given these products from a faux provider. She was tricked and lied to, and she ended up in the intensive care unit with a rip-roaring infection, injecting herself with product that she thought was legitimate because she thought she was getting it from a legitimate provider. So, word of caution. Not only should you not get these products online from a research grade place, but if your provider gives you products that say for research purposes, don't inject those. Don't pay for those. Those are not for you. Those are not tested. Just say no to that and instead say, I'd like to see where you got this from. I'd like to see that this is a 503A pharmacy, which means that it's a patient-specific tested pharmacy. And let's make sure that this is safe for me. When you're getting your products from an in-person provider, that's what you're paying for. You're paying for the accountability. You're paying for a provider that can explain the results, that can explain the process to you. They can explain the side effects. They can explain the dosing to you. They can answer your questions, and they can guide you through this process of making sure that you're getting products that should be injected into a human and are tested for that purpose. I don't really care for even these online platforms that are letting you have a asynchronous telehealth appointment in which you fill out a 10-question questionnaire and then they send you medicine in the mail after a provider has reviewed your chart. 10 questions is not your chart, okay? They haven't uncovered all the things that should be uncovered in your chart. So those asynchronous provider evaluations are crap. They're just you answering the questions, and then whoever's reviewing them is saying, yep, looks like it's risk-free to me. Go for it. And no one's going to be available to follow up with you. No one's going to be available to give you the guidance that you need. So find a provider that you can actually go sit down with and that you can ask to speak with. Even if you're going to meet with someone on that team, you need to know that there's a real human behind that prescription. There's a human that you can get on the phone with, that you could message with, that you can actually have a conversation with in the event that something goes wrong or you have a simple question. In anesthesia, I can tell you it's very important that we stop taking these medicines 7 days before surgery. And as a med spa owner, I can't tell you how many clients reach out to me and ask me that question before they tell their surgeon, before they tell their primary care doctor. And since I'm a real human and I'm really reachable, I can say to them, absolutely stop taking that 7 days before your surgery. Let me know how your surgery goes and we'll make a plan to get you restarted. But if you were getting your medicine from some sketchy online company, I don't know if they'd get back to you. I don't know if they'd know the right answers for you. I don't know if they'd take care of you. If you're getting your product from a research grade facility, I can guarantee that one of those places will not get back to you and will not support you when you have questions along the way. On that same note, when it happens that you're nauseated or your injection is suddenly burning at the site or you've got a new welt and that's not normal for you, or you'd like to change your dosing, who's going to guide the dosing? All of those sketchy online places can't provide you with any of that. You're on your own, you're finding a Reddit or something and trying to guide your own healthcare journey, which is never how it's been with anything else in your healthcare. So why is it okay all of a sudden to do this with peptides? You've never been online before saying, which antibiotic do I need for a sinus infection? And then going to find that online from a research grade facility. It's never been that way before. So why is it suddenly acceptable with peptides to be all over the internet trying to find your own solutions and make your own way with this? You should be able to find somebody with the credentials that can support you properly so that you're healthy along this way. So peptides online are an absolute no for me. You've got to find somebody that can take care of you, and they're out there. Providers are out there. So peptides online are an absolute no for me. And those are the TikTok trends that I see the most common. Perhaps it's because I'm watching those types of videos and I'm seeing them and they're coming up in my algorithms. But I think there's a place for these things on TikTok. I'm thankful that it's out there and it's stirring up the conversation. I'm thankful for the conversation around peptides. It's brought me so many good conversations. It's made me think. It's made me take more courses, read more research, and I love that part about it. So I don't feel like I can say, oh, I wish this stuff wasn't on TikTok, because actually I love learning about things because somebody else posted on TikTok and it sends me down looking up research or taking another course. I love seeing clients come in and saying, hey, I trust you enough to ask your opinion about this thing that I saw on TikTok, and giving me the opportunity for that. And so I'm thankful for the influencers. I don't love all of the advice that they're giving, but I'm thankful that they're out there talking about it and starting the conversation. So keep going out there on TikTok. Keep watching those videos. Just be smart about it. Watch it and say, hey, that doesn't seem like it's a safe thing for me to do at home, but this is where I can look for a professional to guide me along the way. Or, yeah, that does look like something I would do at home. Like in the case of, applying a little bit of Vaseline at the end of your skincare routine. Is that worth it for you? Maybe it is. So give it a try. But those are the TikTok things that I know about. If there's something extra that you want to talk about or that you want to hear further about, go ahead and drop it in the comments and I'll do my best to address it. Thanks, guys.